I briefly want to tell you a little bit about the journey that I took, which was very different than many journeys that were undertaken. And what I'm going to talk a little bit today about is intrapreneurship. It's the act of behaving like an entrepreneur while working within a large institution. What we'd like to all think of ourselves is that we are well-educated, creative people, and that wherever we might be, that we will not accept the status quo. So wherever you happen to be, whether you're lucky enough to be in your own company and it's all perfectly well funded and you're part of that 2%, or you're part of an institution that really needs to do better, we all need to, as physicians, take leadership and to do that thing. So my story is a little bit different. So I was a fellow, I'm a surgeon, I'm a surgical oncologist, and when I finished my fellowship, I had a job at the University of Washington. I was going to have a lab and do my surgical career, and then I had a baby and a husband, and we all couldn't go to where my job was. So I was looking around the Bay Area for a job, and I went to visit one of the universities around here. And one of the fancy professors said to me, well, you know, it's really too bad that you have not accomplished anything in your life, and you better get back to square one. And you know, I was a little bit taken aback by all that, and so I went home and cried my eyes out, and my husband, who's a startup guy, said, hey, why don't you just build your own thing? And I said, what do you mean build your own thing? Nobody builds their own cancer center. I'm a surgical oncologist. You don't just hang up your shingle and build your own thing. But that's what I ended up doing. And so my first job out of fellowship, which nobody is to recommend to take this much administrative headache at the get-go, but was that I went and talked to, unsolicited, the business development director at the community hospital near my house. They did not have coordinated cancer services at this hospital. In fact, every cancer patient was sent out from that institution. And so I said to her, well, why don't we try and construct a situation where the patients can stay in their own community and the care comes to the patient instead of the patient going to the care. A very simple algorithm. So they were mostly diagnosed at El Camino. They wanted to stay home near their care as long as they were assured that it was good quality. The hospital would prefer to keep the patients, and El Camino had medical oncologists, one radiation oncologist, surgeons, and no leadership in oncology. So I took this job, my 0 year out of fellowship, to do this thing, and I sat down and thought to myself, well, I've been at a bunch of cancer institutions. What does that look like? What do people want in a cancer program? And so they want excellent physicians. That is the crux of the problem. In diagnostic specialties, they want oncology surgeons, radiologists, pathologists. They need coordination of care. They need it to be smooth because they're dealing with this whole thing. They don't want to have to deal with, do I get an appointment? Do I this? You know, all that stuff has to be taken care of. Access. So when you have a cancer diagnosis, you do not want to wait 6 weeks to see the academic greatest physician in the world. You need to be seen right away, and you have to get a plan in place, and let's go. Customer service. Again, services to the patient, not patients to the services. A centrally identifiable place. Where do I associate my care being? Am I going to be at the infusion center? Is this the cancer program? What is it that we're talking about? Coordinated care on the med-surg floor with certified nurses that are specialists in my field, top-notch equipment in the OR, radiation, and most importantly, top-tier outcomes and accreditation. So this was my thought going into this. And as everybody has, this was when I talked to the business development person, I went home and I wrote down this little list, and it's sitting in my desk to date, and of what we wanted. Right? And mind you, I was a fellow. I was still in my fellowship when this thing came about. And so these are our people. This is me. This is Dr. Singhal, a radiation oncologist, and this is Dr. Dormady. And we are the team. We've been together since 2007, and we think very similar. That's part of it. We're all very aligned. We treat patients the same way. We believe in patient care the same way. We believe in access. And we believe in the one thing that the system doesn't necessarily do for you, which is humanity, right? These people are coming to you at the worst moment of their life. They just got diagnosed with cancer. And so now, this is the time for a little humanity, a little kindness, a little extra, whatever it is that special sauce. So what do we have, and where do we start? So we had this list, and we needed this list, okay? So at the end of the day, what did I do? Now, many people will be quite surprised, but in 2005, and mind you, I have a PhD, I don't have an MBA, I wrote down this list and I made a business plan. It was 6 pages long. the business plan was then presented to the board, and we got funded $10 million by the board to build a program. So this has been our growth of patients. And so we started in 2007 with and the way that cancer patients are indexed in for size of hospitals is, and how many new patients do you see per year? So if you see about less than 500, you're a relatively small program. UCSF sees 6,000, City of Hope sees about 3,000, okay, just to put it into perspective. So in 2007, we saw 1,000 patients, but they would come to us and then they would leave for all the other areas of treatment. Nowadays, most of the patients stay for radiation, chemo, surgery, whatever it is. But in 2020, we have 2,200 new patients. And for programs to double in size, and that in an area like ours, so we're in Mountain View, in the heart of Silicon Valley, where there's lots of people and lots of places where you can get your care, it's a little surprising to get so many patients. And along with that, the hospital's happy with us. We have doubled our volume. We're about $150 million operation of the hospital this year, putting about 15% of the profit of the hospital comes from the cancer program. But one of the things that we're most proud of is the accreditation, because we can bring patients in, we can do all these things, but are we really providing quality care? Right? That is the important part about coordination of care and quality care. And the Commission on Cancer has a 120-page book on how one is supposed to provide cancer care. So in 2013, we went for our new program accreditation, and we had 6 commendations out of 8. And in 2016, we were silver accreditation. And this year, we were a gold accredited place with 7 commendations. There's only 24 hospitals in the country that have a gold accreditation at the community hospital level. So one of the things that is particularly important to me, and I look at this data all the time, and with the Commission on Cancer, you have to evaluate your data, you know, every 1 to 2 months about, are you treating the patients quickly? Are they getting the right appropriate treatment? Are they getting followed by guidelines and things like that? So we looked at our non-small cell lung cancer diagnosis. These are from 2016 because it takes a little while for the data to catch up. But are we treating the patients in some timely fashion? And one might expect that your outcomes are better if you treat the patients earlier. So if you can get your system to get the patients in within a few days versus a few months, one would assume that people do better. So our mandate in our hospital for the cancer program is, if you come with a diagnosis of cancer and all your paperwork has all been collected and stuff like that, one of the doctors will see you within 48 hours. Okay, 48 hours. That's a tough operational thing to get done. But somebody will break their schedule, somebody will postpone a patient to have somebody seen. So in our hospital, this is our data. For good or for bad, it's published on the web. The average days to first treatment in most hospitals around the country is 52 days. So ours, 75% of our patients are seen before 72 days. In lung cancer resection, so the leapfrog data and all of those things has a lot of discussion about who operates on you. So would you like to know what the mortality is for all of these different patients? So the high volume centers do it like this. Our facility, we had a 0% mortality, 30 and 69 days. So I can talk about this all day. It's a very long topic. What are the challenges in a community hospital of getting things done? Okay. Briefly, it's growth outstripped infrastructure needs. They budgeted us a 3% growth. We drew 25% year after year. Infrastructure never caught up with the place. Well, the changes in the C-suite, our CEO turned over, then all of a sudden somebody else was popular as opposed to us. Operational execution of plans, and how does that get funded within a hospital? I've got long experience trying to get that thing done. So we could talk about that at any time later. I want to tell you in the last 1 minute about a program that we are talking about. Remember, the data for cancer patients is 1 in 3 patients will get cancer in their lifetime. 1 in 3. It turns out that 12 cancers are obesity related, and about 30 to 40% of cancer is actually preventable by the things, as Linda said, your grandmother told you what to do. So we have what's good for your heart and wellness is a preventative for cancer as well. The process meets 9 servings of fruits and vegetables a day. So we have a program called Cancer Healthy in our cafeteria, which addresses this. It addresses exactly what you're supposed to eat. When you look down at your plate, it's a quarter starch, quarter protein, half fruits and vegetables. So this guy ate our Cancer Healthy meal. He lost 80 pounds. And we have 80 for all of you with a New Year's resolution. We have videos on the web that talk about what is cancer healthy and how to manage your nutrition. And I will thank you very much for allowing me the opportunity to speak to you about our program.